So, Dr. Bilski, we just got done talking about veneers and what they are.
Hot topic right now.
Oh, well,
Yeah, it's all over the internet.
Yeah, big time.
Everybody's
big time.
doing it.
Are they permanent? It's done, one and done?
There's nothing permanent in dentistry. Think about it this way. When veneers are done well,
Yeah.
I have done veneers 34 years ago. That's when I started. And they're still in the patient's mouth. Health conditions, clenching, grinding, sports-related things, accidents, car accidents, tripping and falling, biting into your fork. Those are the things that kind of occur. So nothing that is ever permanent, but what we call long-term. Dental insurances with their intel that they have with all the claims they've done over the years, many of years, they're suggesting that about 15 years is the lifespan of a well-done veneer or crown. We have patients that don't take care of themselves, and they have the beautiful smile. They think it's a suit of armor. Kryptonite couldn't even hurt. Decay of the roots, which it's not the porcelain veneer.
Right,
that doesn't decay. It's your natural tooth.
Yeah.
So oral hygiene, maintenance at home. If you have veneers, we recommend an additional cleaning, one time extra a year. So if you're used to coming in twice, we ask that you come in every 4 months, which would be 3 times.
Okay.
And if you come in 3 times, come in 4. If you're not coming in at all, you need to come in.
That's your problem. That's your fault.
There is a maintenance with it.
What if they do get damaged? What happens then?
So the damage part is done, and some patients request, can you just bond over the top of it? There are some materials that you can do that with, and they're very successful. What's success? Well, success would be you're getting married or you're going to an event and you're speaking and you chip your front tooth accidentally.
Yep.
We bond something on temporarily, and maybe it lasts for the weekend, for the month, for the year.
Okay, yeah.
And then we just kind of, as long as it's not bothering you, typically those fall off because there's a chemical bond that you have to do to get an inorganic, which is called glass, to stick to a organic substance, which is your tooth. And then when you have a variation of that system, now you're trying to get a chemical bond mechanically attached. Do you drill? Do you not drill? So typically what we do is it's kind of like just painting it over the top and curing it, letting it set. Tell the patient be careful.
Yeah.
If it's totally damaged, then it's an easy removal of the veneer. Sometimes we use a laser, sometimes we use the drill. Sometimes it is a Novocaine procedure, sometimes it is not. And then we clean off the excess or existing glue that was underneath, the bonding agent, reshape the tooth, take a mold, which now we don't have to use putty anymore. We can use a camera. That's called digitizing.
Wow, yeah.
And then we can email to the laboratory with a photograph. They can scan the picture, scan the tooth, virtually make these types
3D
of
printer
veneers.
type thing, is that what it is?
Well, this could be usually feldspathic. It's an application by hand, or it could be a milled, which is a CNC 3-axis type of engineering thing.
This is like Star Trek. Dentistry has become a little Star Trek-like, isn't it?
It's absolutely, and you can
In a good way too. It's like, it's like.
And you could do some 3D printing too, just to get that last part of it.
All right.
Go ahead.
Well, it takes the ouch out. The ouch is out, and the smile is in, and that's pretty neat. That's exciting.
Sometimes what we talk to our patients about is, if we know this person is kind of aggressive nature, maybe they're a boxer, kickboxer. For an additional fee, it's not the full fee. You'll say, hey, do you want to buy an insurance policy on these veneers? In the event within your sport or your job, something happens. That is so remote, hardly ever happens. But we do have patients that
take you up on it.
We kind of have to do that, or should consider talking.
So if a boxer is watching this, it's like they might want to, check out this dentist. This guy knows what he's doing. This Bilski guy, and he's even got insurance.
Exactly.
That's really neat.
It's nice. And back to the boxer. Say you are a boxer, just to make that clear. We use a technique called Provence, which is an acrylic. Those are so easily repairable. So if you're a young person, that's why we use it for young people or non-drilling procedures or athletes. Why don't we just put it on your teeth, and when you're done with your career and you're not getting hit in the face or tackling anybody, and we have some NFL players that come to see us.
Okay.
And they have that.
Wow, that's
so
neat.
short of it is it's a nice option. Get done with your boxing, then we can take the Provence off. It's simple. And then take the picture molds and send it to the laboratory and you're done.
That's really nice. And it also, this is an aside, but it's an obvious, you tend to know your patients and like you're not just get in there like, cool, let's, it's like, no, what do you need and how you live with it? That counts too. That really does.
We were talking about that this afternoon. We had quite a few patients that have been with me almost 34 years. Yeah. And they're bringing their kids, their grandkids, and I'm starting to feel like the grandpa. I'm 60. I get it, Well,
hey, that's a great, that's great. That's gonna make you feel
good. Though,
yeah.
Like when Johnny shows up, I know he's a clean mouth, and that would be a case. But I have some patients that are still clean mouths, but they always have dental problems.
Yeah.
And if they're at that age point in their life where they're busy, and then it could be a financial decision, the Provence is great. And then when they get through that season of their life, now we can go into the porcelain.
Yeah.
And so there are many alternative options. So that's what I want everybody clear. At least in our practice, we offer quite a few things.
Well, if you don't have a good dentist, Dr. Bilski could be, and his other associates are also great. You might want to think about, hey, might be your kid's dentist, might even be your grandkid's dentist one day. So
you never know.
You never know. Check out bilskidental.com. And again, there's always plenty of videos there with some really good information and stuff. So be sure to check it out.